For a lot of people, weight has nothing to do with willpower. It is not about being good or bad with food. For many adults, excess weight is part of a chronic medical condition, one that involves hormones, genetics, brain chemistry, sleep, stress, and more. That is what medical weight loss is designed to address. The American Medical Association recognizes obesity as a chronic disease. That framing matters. It means we treat it the way we treat high blood pressure or type 2 diabetes, with real clinical tools, ongoing follow-up, and zero blame attached. So what does a medical weight loss program actually include? It starts with your full picture. A licensed provider reviews your health history, your current medications, because some medications can affect weight in ways people do not realize, and your lab work, things like blood sugar, cholesterol, liver and kidney function, and hormones. From there, a plan is built around you, not a one-size-fits-all template. Nutrition is part of that plan, but it is not about rigid rules or living on shakes. It's about finding a way of eating that supports your metabolic health, fits your real life, and is something you can actually maintain. Movement is also part of the plan, adjusted to your body, your energy, and any physical limits you are managing. The Federal Physical Activity Guidelines for adults suggest around 150 minutes of moderate activity per week, but in a medical program, that target is always personalized. Behavior support matters just as much. Sleep, stress, emotional eating, planning around work and family, these are not soft extras. They are clinical targets. New habits need structure and follow-up to stick, and that is what the ongoing visits are for. When it comes to medications, they are never the first step and never a guarantee. Most clinical guidelines, including those from the Obesity Society and the American Association of Clinical Endocrinology, say prescription weight management medications may be appropriate for adults with a body mass index of 30 or higher, or 27 or higher, when a weight-related condition like type 2 diabetes, high blood pressure, or sleep apnea is also present. Even then, medications work alongside lifestyle changes, not instead of them. A provider will also review your other medications, your organ health, and your personal situation before anything is prescribed. At SendSlim Clinic, all of this happens by secure telehealth for adults who are physically located in California or Nevada during their visits. There are no crash diets, no shortcuts, and no pressure. Just a structured clinical plan aimed at sustainable metabolic health. If you have been trying to manage your weight on your own and feel like something is missing, that is a reasonable signal to ask for a clinical evaluation. Talk to your primary care provider, or find out whether a program like SendSlim might be a fit by visiting sendslim.com to check current availability in your state. The practical takeaway is this: treat weight like the medical condition it is, and get the same level of care you would expect for any other chronic disease.